So you may have heard about the recent changes that the CDC made about wearing the masks. And you may be wondering, what the heck does that mean? Well, in this video today, I will discuss why there is a change in the new recommendation, what type of different masks do we have, and 7 tips to help out with your homemade masks. Coming up next. So a couple of weeks ago, every single healthcare provider recommended only certain people to wear the mask. Those that are sick, those that are in close contact with people who may be infected, or those healthcare providers who are treating COVID-19 patients. Well, things changed dramatically in the past couple of days. The CDC, or the Center for Disease Control, recently recommended everyone who goes outside to wear some sort of mask. Why is that the case? So the information from COVID-19 is changing literally on a daily basis. This virus just became a pandemic in the past couple of months, and just recently are we getting more and more information about this virus. We're getting more studies, how this virus is, what the effect is on this virus to people, and how it can spread. And with this comes rapid change and new information literally on a daily basis. And what we're also finding out is that most of the spread of the virus are from asymptomatic carriers, people who may have the virus but not realize they are sick. They're causing more and more people to get the virus. They're also causing the spread of the virus very rapidly, causing that rise in that level and the prevention of the flattening of the curve. And so because of that, what we need to do is stop the spread of the virus. And the best way to do that is for everyone to wear a mask. When you wear a mask, that covers up your mouth, so that prevents the air particles from spreading from me to someone else. So for example, if I have COVID-19, there's a chance I can spread that virus by merely talking to somebody else. So with me wearing a mask, I am covering up those air particles so that virus can't go anywhere else. It is just within myself. The best way for you to prevent the virus is for you to socially distance yourself. But in practicality, that can be very hard. You may need to go to your pharmacist, you may need to go to the doctor, you may have to go to the grocery store, and you may be in contact with somebody who could have the virus. The more that you're out, the more chances are that you can get the virus. So one way to help prevent that is for everyone to wear a mask, so that if you become in contact with somebody who has the virus, you can protect yourself by them and you wearing a mask. Now keep in mind with this change, even though we do recommend every American to wear a mask, it is not necessary for everyone to wear a medically grade mask, nor is it necessary for everyone to wear a surgical mask. The CDC and the Surgeon General recommend a homemade cloth mask, and that should be enough. So what are the different types of masks that are out there? There are 4 different types of masks. The first one's called the P100. The P stands for oil proof, and the 100 represents the percentage of particles that are filtered, which is roughly almost 100%. So those P100 masks are like those masks that you see with Walter White, where he's wearing that big old mask, hanging out in that meth cave, trying to make his blue meth. The second type of mask are the N95. These are the medically grade masks, and these are the ones that we use as healthcare providers whenever we're dealing or treating with COVID patients. The N means that it's not oil resistant, and the 95 means that it can filter out about 95% of the air particles. The third type of masks are the surgically grade masks. These are the ones that you may have seen on TV shows like Grey's Anatomy, or the ones that people wear outside. These can filter out about 60 to 80% of air particles. And the last type of masks are the homemade cloth-based masks. And if you use 100% cotton, this can filter out about 60-80% of all the particles that are out there, very similar to a surgically grade mask. So the best masks that we recommend so far by the Surgeon General are the 100% cotton-based masks. Yes, this is what it is, just like Hanes, cotton. No, it's not underwear, guys. I promise you, I'm not wearing underwear. So whenever I speak, the aerosolization of me talking is actually found to be a way to spread the virus. So by me wearing the mask, not only can you not hear anybody, what? I can't hear you. What did you say? But I also prevent the aerosolization of whatever I'm speaking with from going to somebody else. So basically you're having 2 people who literally cannot hear each other, and they get so frustrated they just go apart. That is the epitome of social distancing. Now here are 7 tips I recommend to all my patients who are wearing homemade masks. Number 1, you gotta wash it daily. You have to assume that whenever you wear a mask outside, that it is contaminated with SARS-CoV-2, and you have to wash it every single day. And the current recommendation is to wash it with your laundry. We don't have any recommendation about using this in a dishwasher. Number 2, when you're removing the mask, remove it appropriately. Go behind the head, remove it, put it down. Don't touch your eyes, don't touch your nose, and don't touch your mouth. You have to assume that your hands are infected. And if you touch your eyes, your nose, or your mouth, there's a good chance you can get yourself infected. Number 3, guys, for the love of God, wash your hands, especially after you use a mask. You have to wash your hands all the time. Become obsessive about it, and make sure you please wash your hands after you handle a mask. Assume that it's infected and just know that you have to wash your hands to get rid of the infection. Number 4, 100% cotton seems to be the best material that's out there. This is comparable to a surgical mask. Now, having said that, we do not have any data or studies to compare cotton to silk, to coffee filters, to vacuum cleaners, to whatever. We just do not know that information, but the Surgeon General recommended 100% cotton as the option for a homemade mask, and that is what I'm recommending for my patients. Number 5, you still have to socially distance yourself. Guys, a mask is not a force field. It is not going to protect you from everything. Just because you wear a mask does not mean you can go up to everyone, give them a hug, high five them. Don't do that. You still have to maintain social distancing. Don't go outside if you don't have to. Only do essential items. Only go do essential errands. If you go outside, stay 6 feet away from people. Do the things that you need to do to protect you and your family. Literally, you cannot get sick if you are not in contact with someone who is sick. If you want to stay home and you can stay home, do it. But if you have to go out, a mask is what you need to do to protect yourself, but still maintain that social distancing even when you're outside. Number 6, I am recommending a light test for my patients. So for them to use the mask, have a flashlight, shoot it across that mask, see if you can see that light behind that. If you can see the light, you may want to consider adding more layers. If you can't, that seems to be a good mask. And number 7, kind of controversial. It seems like facial hair may make it more difficult to wear the seal around that mask. So if you have a lot of facial hair, you may want to consider shaving. I know, this may be a big deal for a lot of people, and I completely understand that. But we currently are not sure if a facial hair will prevent you from having that perfect seal that you need to prevent the virus from coming in. Once again, there are no recommendations for which type of mask is the best. So we don't know if one mask is better than the other, but we do know that wearing some sort of facial shield or some sort of mask is certainly better than nothing. And this is a way for you to protect yourself if you have to go outside. My question of the day for you guys, what questions do you guys have about homemade masks? What have you learned? What have you gotten from this video? Comment down below. I'd love to hear what you guys have to say. But I want to thank you for watching this video. Don't forget to smash that like button, share this video, and don't forget to sign up for my weekly newsletter as well. But guys, stay happy, stay healthy, and stay safe. So should I do my whole video with the mask on? Can you hear me? So in this video today, I'm going to tell you exactly why I am wearing a mask. And as it's going down, that is not a good thing. Or those who are in communication or in contact, or those who are, those that are sick, those that are in close contact with, from your mouth to someone else. So those air particles, I can't speak today. The P stands for oil. And if you use it, and the last type of masks are the cloth masks. Golly, I can't speak today, man. And the last type of masks are the for use for people to wear all day. Golly. And that is what I am recommending. Number 5, you still have to golly. Don't do that. Don't pick my nose. I'll take a picture of this.